So I have two groups of 10 people. I put each group into a box. I walk away and leave them for a week. When I return, the first group look at me with absolute pride at what they have accomplished with their box. And they have indeed created something that looks fantastic. Truly a work of art, what they have accomplished. However, in this second box, there's no one there. So I turn to look at the inhabitants of the first box and I ask them this: why are you still here?
Like Dr. Hansen said, that there are a lot of cases that have minimal symptoms or that have very mild symptoms.
After days of being accused of giving mixed messages, the Prime Minister now says that face coverings should be worn in shops in England.
You see, what you've just said is completely against the new rules as stated. So there you are.
The thing with conspiracy theorists is that the more you engage in an argument with them, the more oxygen you're giving them. The more, ultimately, I think people can judge for themselves.
Here we are with alarmist political behaviour everywhere, leading to alarmist headlines. Victoria now in official state of disaster. Why? 671 new cases yesterday and 7 more deaths. Don't you love it? New cases. Let's deal with the deaths. You know my view, anyone's death diminishes us all. But I've scrutinised the World Health Organisation figures for today, midday. We have 43 people.
With the sheer volume of information and misinformation currently in circulation from both mainstream and independent news sources, one can be forgiven for being totally confused as to what to believe. So whereas the focus of the last episode was to take a retrospective look at how global actors may have manipulated an illusion or planned illusion, this episode aims to provide much needed clarity by way of 10 easy to articulate facts no one can deny, regardless of your view of the pandemic or planned illusion. Over the past 5 months, the UK's most respected veteran GP and acclaimed author, Dr. Vernon Coleman, has tirelessly been the voice of sound, unbiased reasoning, providing accurate information on all health matters relating to the virus via his YouTube. In this episode, we hear his summation of 10 facts no one can deny.
Number 1, many doctors, including Dr. Fauci, the American coronavirus supremo, have admitted that the risk of dying with the coronavirus is similar to the risk of dying with the flu. Number 2, the flu can kill over 600,000 people a year around the world. Even though governments everywhere have admitted fiddling their totals, the UK is just appalling. The COVID-19 death total is still nowhere near a global flu total. The only conclusion is that the coronavirus isn't as big a killer as the flu. And number 3, here's how they fiddled the figures. In the UK, anyone who tested positive for the coronavirus and then died subsequently, weeks, months later, was officially a COVID-19 death, whatever else they had wrong with them. If they got run over by a bus, but they'd been tested and proved positive, then they died of COVID-19 and not the bus. Number 4, the vast majority of those dying with the coronavirus were over 80 and had many other health problems. The risk for fit young individuals is very small. The risk for children is smaller than the risk of being hit by lightning. If you're going to put kids in masks, you should take the masks off and give them a lightning rod, because that would do them more good. Number 5, research has shown that I believe that masks are dangerous, don't prevent the spread of infection, and almost certainly do more harm than good. The virus can go straight through the material of a mask, and mask wearing affects blood oxygen levels. At least 2 people, they were in China, but 2 people have died through wearing masks. I've quoted all the figures and the papers, and there's tons of figures and papers, including a very good paper in the British Medical Journal. Number 6, many of those promoting the coronavirus horror story are linked either to the vaccine industry or the Bill and Melinda Gates Foundation. Vallance, the Chief Scientific Advisor, was formerly a Chief Senior Executive at GSK, which you've just said is providing one of the vaccines for us. Number 7, the British government has admitted that at least 4 times as many people have died as a result of the lockdowns as will have died from the coronavirus. The remedy's been much deadlier than the disease, and it's going to be a lot more than 4 times because of all the cancer treatments not being done. Number 8, Neil Ferguson, the man whose predictions led to the lockdowns, has produced a number of inaccurate predictions. His track record is appalling. The college where he works has financial links to Bill and Melinda Gates and vaccines. Number 9, exactly the same mistakes have been made in every country in the world. The thing we were talking about earlier on, with the old people being taken out of hospital and dumped in care homes, that could not be a lot of coincidences all around the world. If you remove the care home deaths from the UK total, you end up with 20,000 deaths. And that's a massive exaggeration because they included flu and anyone who tested positive. Number 10, the number of people who've caught the coronavirus worldwide is now said to be around 10 million. And everybody's getting in a flap, but the flu can affect 1 billion in a year.
In the numerous conversations you're likely to have with friends and loved ones regarding this topic, my hope is that this episode can be used to help them in their knowledge gap, to ease their mind, and also to put them at rest.